So for today's session, we thought about talking about the whole therapy process, what it involves, what are the important aspects of it from the therapist side, but then also from the client side. And to start off, I can quickly talk about my experience as a psychology student. Recently, we went over all this, and I'm already interested to know more about what this looks like from you, Tali and Cindy, in practice. But from the theory that I got to know, the thing that stood out was how most of the therapy, most of the healing process that people talk about is genuinely more the aspects such as the therapeutic alliance or
Mm.
the the empathy during the whole therapy process, the listening, the being able to sit in that space, hold that space. So most of therapy revolves around that and not around the specific modality, which is interesting to know because I think most people don't really they think the therapist has some magic answers or knows everything and that's how they heal, which isn't quite true. And I think it would be really interesting for us to have a closer look at what exactly it means to do therapy, what the whole healing
Mhm.
process looks like.
Yeah, yeah, it's a fascinating topic, Manuel. I want to start by saying that therapeutical relationship is probably a very unique one. You know, it has
Mhm.
aspects of this like mentorship relationship. It has aspects of like a bit more family community relationship. It has some aspects of friendship as well, but
Mhm.
it's none of those relationships. It's a very unique one. So I think,
Mhm.
and I've heard it from my clients, maybe clients who've been to like a lot of therapy before, and they see how different every process is. And it's not because one process doesn't work, it's because their relationship with every therapist is so different.
Mhm.
And people tend to think like, oh, therapy is not working for me. Maybe it's not therapy not working, it's that you're not being able to build a connection with this specific therapist. And I think we need to be okay with that. Like, it's about finding the right fit. Not every therapist is for every client, and the other way around. So, yeah, there's something very unique about the quality of that relationship.
Hmm. Yeah, that brings up a lot that resonates with me, everything you're saying, Tali. It also had me thinking while you were speaking a little bit about the work that we do, the two of us do, which is with very diverse population. So we also have different maybe cultural expectations in clients, experiences they've had in their families or in countries they've lived in that might also bring something into the room, where it comes to this
Yes,
power balance. Like maybe we're
yes,
seen more equal, as Telly is noting about almost like a friendship type relationship, or maybe
yes,
there's quite a, well, you're the one holding the knowledge that will fix me idea,
yes,
So
yes,
that also comes into play. So there's so many, as Telly says, it's such a unique relationship as you build it. And
yeah.
and I would say, for a lot of clients, you might have a feeling fairly quickly, like even in maybe the first couple of sessions, that, oh, I think I am fitting well with this therapist and vice versa.
Mm.
Um, but not always, right? So
Yeah,
the whole thing is really a
yeah,
fascinating study in being a
yeah.
human and clients coming in because they want something to change, right? And then they're hoping this person
Mm.
maybe has the answers or the way to help this change come about. So, yeah, I mean, I have many things, of course, as I'm sure both of you do too, but
Yeah,
you want to say. So I'll leave it at that. But I just wanted to add in that cultural piece because I think that's really fascinating with the types of clients that we work with.
absolutely, absolutely. And I was thinking about a client I had recently who they were coming from a very religious culture, and they had never tried therapy before, because like they've been dealing with their issues through religion, which is understandable. And now they wanted to try something different. But I think especially the first sessions is so important that you meet the client where they are, in order to build this relationship.
One thing that just popped into my head was, with everything that we just mentioned and you guys talked about, from a therapist perspective, how would you be able to know? Because I bet, like you also just mentioned, Talia, there might be some clients that, have a completely different worldview or come from a different background. How would you be able to tell if this is a good fit or not? And is it the responsibility of the therapist to then try to navigate it? Or if they notice this isn't a great fit, be able to say, okay, see, maybe this isn't working, which I'm just going to quickly give my opinion before,
Yeah, absolutely.
I would argue, from what I would think, if I were in this situation, I think as a therapist, first and foremost, I would want to try to help them adjust to them, right? Understanding that whatever mindset they have, that we can work together with it. But I would also try to give them the tools to know when to notice, okay, maybe we aren't the right fit, and make them know that that's also fine. Because I would think that some clients, some patients, they don't even quite know, how we mentioned in the beginning, how they might just think therapy isn't for me. And I think it would be great to tell them, look, maybe it's just our bond that doesn't work, therapy itself. So a few things I touched on that right there, but I guess the overarching question would be, how would you as a therapist know if the client is a good fit? Is that even a good question to ask as a therapist, or is it irrelevant? So I guess that's the question for you guys.
I think the first thing that came to my mind was like, well, professionally, there are limits to our profession. And I would say the first few sessions for me are also like a bit of screening to see if I will be able to support this person, or if they need something else. Like I can work really hard in building a bond, and I can build a successful relationship, but maybe this person needs in-hospital treatment. So even if we build a very successful connection, they need something completely different, or they need a more, they need like a top tier intervention that I cannot provide. So I think there are those limits. And I think also, in my case, I tried to do like a check-in after session 4 or 5. So in the first session, I always tell my clients, you tell me if something doesn't resonate, if you don't feel comfortable, because that's all important material for the session, right? But maybe after session 4 or 5, we do like a check-in, like how is this working or not working? And I find there are, for example, clients who want to be good clients. So they really want to do the work because they want to be the good client. So you can be creating this artificial relationship, or this artificial therapy setting, because it's not about them being good clients and me performing well as a therapist. So I even ask that question to them, and I share my feeling. I get the impression that sometimes you want to be like a good client, and maybe you're not telling me things that are not working for you. So it's that's like the first things that pop to my mind when you ask that question.
those were my things, many of them as well. So I'm trying to think what I could add because these were definitely in my little mental checklist as you asked your question, Manuel.
Hmm.
Maybe it does bring us a little bit towards this concept of rupture and repair within the therapeutic relationship. I really find it fascinating what Tali just ended with, and that piece of a client wanting to be a good client and to do everything right, or feeling like they're failing if they're not better or better, whatever.
Yeah.
I'm going to put that in quotation marks.
Mm.
Um, feeling not feeling comfortable enough or feeling even some shame that they come to a session, a week later or 2 weeks later, and things might seem worse or darker or more
Mm.
complicated, that there hasn't been whatever we want to measure as improvement or
Mhm.
successes. And that can get really uncomfortable in the room and needs to be addressed. I really
Yes.
believe that is, as Tali was mentioning also in her answer,
Mm.
such an important part of the therapeutic process. Those check-ins are important. Try to do them every session, even, small check-ins. However, I think as a therapist, we also have to be very aware of that piece that Tali's talking about. Maybe they just want to do the right thing. Maybe they see the power imbalance and it feels like, oh, I better not. I think their
Yeah.
therapist is carrying more power here. So I'm not really comfortable telling them how I'm feeling, how I'm doing in this situation.
Yeah.
Anyway, so I'll add that
Yeah.
for now, but
Hmm.
yeah.
Yeah. Yeah. And I would also add maybe like these self check-ins as well, like you you don't know what you are going to find out with the client when you start the process, and the chances are that this person is coming with something that will trigger you personally. I mean, that
Hmm.
happens all the time. So I think these like self check-ins during the sessions or after the sessions or with your supervisor are also important to keep the therapeutical relationship as like clean as possible,
Yeah.
because you can also start to bring things from your own like transference and counter transference to the
Hmm.
relationship with the client, if that makes sense.
If I could just add,
Hmm.
Telly, because we're both trained in
Mm.
IFS, and so when you
Mm.
when you work through internal family systems training, that's one of the important sort of modules and then ideas that stays with you in the training is that you check in, even in a session, you notice your parts. And one of my trainers would say, if I notice a part, I just write it on a sticky, just for her, the therapist, to say there was my, anxious part coming up or whatever it might be. She said I would just put it there, and then after the session, I would kind of go back and try and have that self check-in and work through this idea of, how can we show up with self-leadership as a therapist as opposed to our parts taking over when we're in
Yeah.
session. So that's a fascinating side piece based on the training that we have
Hmm.
in IFS.
Yeah.
I just wanted to quickly add on to what you just said, Cindy. I think that's a great point. And it shows that we even went over this in uni recently, which is why I just wanted to add it, is that there was research done on the effectiveness of therapy sessions and what can make it more effective or have better results. And it did show actually that being, I forgot the exact term for it, but if you've had or if you have certain things bothering you, because we're humans, if it's anxiousness or whatever it is, if you are able to in a healthy way deal with it, it might actually help you in the therapeutic process. And what you just mentioned, that example, I feel like is an example for just that. You might still notice anxiety come up. You might still notice whatever part it is, come up
Yeah.
during these sessions, and being able to notice it, right, write it down, and still process it yourself. I
Yeah.
think that makes you a better therapist, actually, because you might be
Yeah.
able to connect better, be more empathetic, whatever it is. So I just wanted to add that quickly. I think that's super
Yes,
interesting and goes to
absolutely.
show
Great way to
as a
say it. Yeah, it
therapist.
helps us hold the
Yeah.
space for our client, right?
Hmm.
When we notice the
Yes,
part coming up, just
Hmm.
yes,
tell it to kind of give you some space as a therapist
yes,
and hold that
yes,
space for you and your client. Yeah.
yes, yes. I remember in one training I did, the therapist who was leading the training, he said, like, as a therapist, you're using like these brackets where you're putting your own.
Is that me or did Tali quickly?
I don't know. I'm here. It's
Yeah,
Tali,
okay.
maybe. I
We can
know I
quickly
can't,
cut this out. No
we
worries.
might
I can
have
just,
to. And you
yeah,
came
I
in
can
a
just,
teeny bit in and out as well, Manuel, but then it was fine.
Point
really?
list.
Oh, okay. It might
Well,
just,
Oh,
oh,
hey, I think I was frozen for a
you
few
were frozen
seconds,
after
minutes.
bracket.
yeah,
Oh
bracket,
no.
and then
Am I back?
you're
You're
back
back.
now. I can just edit
Sorry.
it. But
Sorry.
Cindy was
Okay, okay,
mentioning
okay.
there's some,
Yeah, I
yeah,
don't know what's happening today, but we seem to.
it's for me, it's the Wi-Fi. Once I move to a new place, it's hopefully going to be better. And I think Tali's
Yeah.
was also just a quick
Okay, and it could happen to me
Yeah,
at any minute. Trust. So let's. But
Wi-Fi.
anyway,
yeah,
go
it
ahead,
was my
Tali. And
Wi-Fi.
was it
Sorry. I
okay?
was, yeah, it was my Wi-Fi, but I think it's back.
Maybe you can just say something like, okay, where we stopped off. So it makes sense when I cut it, it will be
Yeah,
like,
yeah, yeah, yeah. So I went to this training and the teacher was talking about this idea of, as a therapist, you have this bracket where you are putting things that come up internally as a therapist. So the things that you think or feel or make you uncomfortable, because you don't want to bring it in the room. And that's, I think,
mhm,
the important ability of a therapist. But of course, you need to deal with that later.
Mhm.
mm,
So I like this idea of we have this, yeah, we have this space where we're like putting our own
mhm,
internal processes or parts that are being active. And I think that's what makes this relationship unique as well. That
mhm,
allows you to be very present.
Yes.
Because if you're talking to a friend or your partner or someone in the family, like you're not using the brackets, like
mhm,
it's you're interacting with all your parts with the other person. So
Yeah.
yeah, I think like training disability, I think is also part of being a therapist. Yeah.
mhm.
Yeah.
Hey, then I was just waiting to see if you just wanted to add anything, Cindy. In that
Just
case,
completely agree. I mean, completely
mhm,
agree with everything Tali just said. It's
sure.
just
Because I
fascinating.
did have another question because everything we've just said super fascinating and interesting, and also for me, right? It's cool to see how it's applied in practice and how you guys do it. One thing that I'm also interested in is in your guys' experience, what is it like the relationship building process? And then also, did you guys potentially have an experience where that rupture might have happened and you had to deal with that? So I know for you, Cindy, you just recently, right, like with your new practice, but maybe in the counseling that happened, and for you, Tali,
Yeah.
maybe with the practice, something like that. How did you deal with it? Yeah.
Yeah, I mean, definitely there have been experiences where there's been rupture or there's been a need to talk about something in the room. Or I will also say something that happens that can be really uncomfortable for a new therapist, and maybe this continues,
Mm,
even into very experienced therapists, but this concept of like, maybe a client has sort of ghosted you or they just aren't coming back, right?
yeah.
Maybe you're reaching out, well, it's Natalie, yeah.
Mhm.
Um, Sometimes there can be rupture and really no way to find a space to repair it. You just have to work
Yeah.
out through your own self as a therapist. So
Yeah.
that this doesn't sort of add into some type of, adding into like some type of a more imposter syndrome, or what have I done wrong? What should I have done differently to have this client stay with me and continue sessions as opposed to, not replying to my emails and not making another session or something. That can be
Yeah.
really okay. So Tally's
Yeah.
agree. It brings up a lot of
Absolutely.
things, doesn't it?
Yes, absolutely. And I was thinking,
Yeah.
because we both have a similar experience working in schools, and we were working with students like similar ages, like adolescents. There is a lot of conflict and there
Yeah.
is a lot of rupture happening all the time. And because you're in a school, like it's not like you're breaking up with your
Right.
student, like you need to train this ability really hard. You need to be able to be the adult, and you need to be able to, maybe the student needs time, but you need to be the adult who is able to repair the bond.
Yeah.
And I think we both had that so much that I think for me it was a great training for
Mm.
today with my clients. And I've had a few clients who've expressed their frustration, and this is not going anywhere, and I don't want to come back. And it's so easy to, I think, have your scared parts show up in that moment. Um, but I think because I had this training, I was able to have this difficult conversation, like go through the conflict that is present. And yeah, maybe repair doesn't mean we keep the process. Maybe repair means like they move on with something different, or they need a break. So yeah, Cindy said, like repair doesn't always look like you go back to working with a client. Yeah.
Mm.
And it's hard. I think it's hard
Mhm.
for therapists, like, yeah.
And what about, because this is what comes to my mind that could happen giving therapy, if, for example, because what we just discussed would be that I would call it a complete rupture where they ghost or they don't come back. How would you deal with one where the client does come back, but you notice maybe even during one session how they start to not really trust you, or they are a bit, standoffish, and you can tense or sense the tension. And I guess because we as therapists are trained to notice these things, or they might not even notice that this is going on. From what I've learned
Yeah.
during university is to, in the moment, mention this rupture and talk about it. And I was just curious if that's also what you guys would do, how you guys would deal with this, if maybe this has happened. So like the in the moment, in the therapy session moment, how you would deal with that rupture.
What's coming up for me is actually sort of almost part two of what we were just talking about, and the different
Mm-hmm.
parts that would be showing up for me. I pretty much know what some of them might be.
Mm-hmm.
And so, one of the ways I do try to work in the therapy room is definitely acknowledging that that's there, and then turn towards curiosity. So with my client, there would be questions that I would do my very best that those questions are coming out of curiosity, compassion.
Mm-hmm.
Yeah, that would be sort of how I would
Yeah.
begin to see how I could work through that. Yeah, without
Okay.
giving any
Yeah.
examples. I realize I'm not giving any specific examples, but it would be
Yeah.
Sometimes
that
it's
those
hard,
those two
right?
words. Yeah.
Yeah.
Uh-huh.
I
Okay.
had a yeah, few rough experiences when that happened during the session.
Mm-hmm.
Um, and I think apart from curiosity, which is so important, is this compassion, like trying to understand that this rupture or this almost like breakup that the client is presenting is not personal.
Mm-hmm.
Like, and try to be understanding of where is it coming from. It's not against me, even if it's affecting me in the moment, even if I will feel my imposter syndrome. Or I will question myself as a professional. Like in the moment, I think trying to hold the space for the conflict and trying to let the client go through their sometimes frustration or anger, or so I've only had that a few times, and it's been difficult. Yeah, I think that's probably one of the most difficult experiences I've had, because I'm not a therapist who's very confrontational. So my style is different. So I think that for me personally is hard to handle. Yeah.
And you're likely talking to two therapists with some of that similarity,
Yeah.
right? That
Yeah.
style.
Yeah.
But it also brings up something for me in that yeah, it's not personal. And you're not quite sure what you could be also providing for your client in that moment. That, allowing them their autonomy to speak their truth, and maybe they haven't had a place in their life to do that. And you might never even know what that could have provided for them or how that could have helped them grow. I mean, maybe it didn't, maybe it didn't at all. Maybe it was
Yeah.
almost an immature situation that didn't really provide much growth. But at the same
Yeah.
time, it's like, yeah, it's so hard to know, right, where it's all coming from. And I definitely, it's not the most comfortable spot for me to be in when it's happened. And it hasn't happened very much to me
Yeah.
as of now, but there have been things, definitely.
Yeah.
Definitely, yeah.
Yeah. Yeah. And I think it also like brings this idea to my mind right now of therapy has become so popular that sometimes there's this idea that everyone should go to therapy. So sometimes I've had clients who needed something completely different. They needed something more confrontational, or they needed something more like coaching, like a very structured 6 sessions process. So also like keeping that in mind, that because going to therapy is very popular at the moment, it doesn't mean that's what the person needs when they walk in the room with you, and keeping that door open.
Yeah, and when I think of sort of the way we look at biopsychosocial as far as the therapeutic model, what Tully said is so true. It might be more that they even need more medical interventions, which was sort of mentioned earlier in our talk too, right? There might be more that transferring over to more medical doctor care might be the real support they need to get certain things sort of all, in line for their physical health. Or they might really need community. And,
Yeah.
and maybe that therapy space just gives them that jumping off point, and it might not be many sessions even, right?
Yeah.
Where they really need to jump sort of into and figure out how to find the confidence to what do I need? Maybe it's more community based, and maybe it's
Yeah.
yeah. So
Yeah.
yeah,
Yeah.
I'll say that.
I guess that goes to show, listening to everything you guys just mentioned, it shows how well versed or how much goes into the role of a therapist. It's not just healing someone, but like you just said, it's being someone who might nudge you in the right direction. It might be someone to sit with you in tough moments, just sit with you to feel, or someone that you know feels in a different way than what you're used to. So if someone is very confrontational, instead of reacting back, you sit with that and you try to help the other person understand, where's this coming from. So what I just wanted to say is, it's interesting. The role of therapist, when you go into it, it's so, has so many different aspects to it that I personally wouldn't even realize, just being in uni and going through everything. And I think it's something really, for me, it's motivating. I like that. I think that's a really nice thing about it. One thing that while we were talking that still popped into my head, right, to also kind of close everything up, was from the client's perspective, what exactly can they look for when it comes to choosing a therapist or knowing what's right for them? Because of course it's also the role of the therapist to then, nudge them in the right direction. But what could a client look for when choosing a therapist? I remember when I was younger and I wanted to also, see a therapist, I had no clue. And I know for a fact if I knew what I could look for, it would make the whole process so much easier. So I would have from my own experience, my own kind of go-to things you could do. But I'm also interested in what you guys would say is what would you guys recommend to people who are looking for a therapist, and what exactly could they, look out for?
Yeah,
Yeah, I think
tricky to know where to
it's a
start on that one.
yeah.
That's a big question, but
Yeah.
It's yeah,
Yeah.
I think like being aware that there is no like one size fits all process, and that
mhm,
you are going into this idea of going back to what you said at the beginning. You are building a relationship with someone,
mhm,
um, which is a very unique relationship,
mhm,
So I think yes, the approach is important, like some people may be more like CBT in their needs. Some
mhm,
people may be looking for more like psychoanalytical approaches. And people do some research nowadays before they go into therapy. And they would ask those questions. But what I would tell the client is like be very, very honest with themselves about, is this creating some inner movement? Is this
mhm,
like you leave the session with like a new idea, or with a lot of questions, but there is something is happening. It's not like you're
mhm,
sitting in a room talking to someone and then you leave feeling that nothing was moved at all.
mhm,
So I think that's like a good sign for someone to know if they found someone who's like a right fit for them. And that sounds
mhm,
very intuitive, but I do think it's true. Like,
mhm,
yeah.
And then I would add, and it's the title of our podcast, isn't it? So
Mhm.
as you've left the session, and maybe Tally, you were also meaning this, but what happens between the sessions? You're
Yeah.
starting to become more aware of certain things that you then
Yeah.
go, oh,
Yeah.
that's that conversation that I had in therapy.
mhm,
Or
Yeah.
maybe something lands differently for you, and then you realize, oh, well, actually, my therapist mentioned something about that. And maybe it wasn't even something that sort of you were able to process in the moment. And then all of a sudden, as time
Yeah.
goes between these sessions, you're cluing in. And then that, of course, is building the relationship, even when
Yeah.
you're not
mhm,
seeing that person, because when you then come back into the therapy session,
Yes.
that foundation is
Yes.
building and building, right? So I think if
Yeah.
that's
mhm,
happening as well,
Yeah.
becoming more aware of things during your between times, that's a
Yes.
good
Yeah.
sign. Yeah.
Yeah. And people usually go to therapy because there is this idea of change, like you want something to change or evolve,
mhm,
or you want to see some growth. Um, and that doesn't happen in session 1 or 2. That's
mhm,
that's also part of building the relationship with your therapist. So I would say that change takes time. And maybe, yes, session 1, 2, or 3, you have like very powerful insights that will like start something very important for you in your life. Um, but it's a process. So I think
mhm,
it's important to remember that it's regardless of the type of approach, like it is a relationship that takes time to build, and it is a process.
mhm. I love that. I realize now, how big the question was when I
Yeah.
asked it. But then when you guys answered it, that was exactly what I was thinking, to be honest, in the beginning. And it shows maybe there isn't a one fit answer to how can I know what therapist is good for me. It goes back to, I really think, when you would ask someone, what friend, what qualities do they have? You could more or less know, like, okay, they have to be open, empathetic, whatever it is. But at the end of the day, it's also more of the feeling you get over time. And it's that what you mentioned, the between sessions, the spontaneous thought, oh wait, my therapist mentioned this, noticing how it has an effect on you.
Yes.
And exactly, I think that's great also for people to just realize that that is the whole process of healing. That is therapy. It's having a therapist that you do feel comfortable opening up with. That of course has to be there, but except for that, it really is just going along with the process, building that connection with your therapist, and treating it as that. And then with time, the healing happens. Through that journey.
Yeah.
So I guess that's how you can see it, 100%.
Yeah.
It's a bit more nuanced. It's just,
Yeah. And I would also add this, which is obvious, but I think is important, like this safety piece, that this is such a safe relationship for the client that they can say things they've never said before. You know, they can, without feeling like they will be judged.
Yeah.
So like creating this, like being this safe space for your client. And for the client to actually, sometimes they look forward to that, you know, like I've had clients who say like, it's been 2 weeks and I really need to talk about this because I can't talk to my husband or my friends, or so like having this unique space where you, and maybe as a therapist, you don't have to say a lot. Maybe you're just holding the space for all this in like content to be present. And I think that's also a very powerful aspect of a therapeutical relationship. Yeah.
I really enjoyed the topic today. I just want to end it off on that. I obviously already knew some things about it, but it's always just super interesting to hear the real experiences and having you guys share what you guys experienced, really, you know, in the process, being there, going through everything. And I just love learning more about it. So I'm already excited for whatever we're going to talk about next time. But today was definitely really nice.
Thank you, Manuel. Those were very insightful questions. Thank you, Cindy.
I really appreciated that. Thank you. Thank you both.